Right now, millions of seniors are walking around with a ticking time bomb in their chest, and they don't even know it. Most people assume heart disease only shows up as chest pain or shortness of breath. But here's the shocking truth. Your heart can silently weaken for years, sending distress signals throughout your body. And once real symptoms appear, it's often too late. A major 2023 study revealed that nearly half of all heart failure cases go undiagnosed until they reach a critical stage. That means the early signs were ignored or mistaken for something else. Many studies have identified over 50 warning signs of heart damage, but I've narrowed it down to 13 that many seniors, and even many doctors, often overlook. And today we're uncovering them all. If you notice even one of these, take action before it's too late. Your life could depend on it. Are you ready? Number 13, jaw, ear, or tooth pain on one side. Pain in the jaw, ear, or even tooth, especially on the left side, can be a warning sign that a heart attack is approaching. A 2021 study confirmed that pain in these areas can signal reduced blood flow to the heart. This is because the vagus nerve, which connects the heart and brain, sends pain signals to areas that seem unrelated. Many people assume it's just an infection, a sinus issue, or a cavity, and don't realize it could be coming from the heart. This is actually the symptom more common in women. If you feel tightness, aching, or pressure in your jaw, ear, or tooth that comes and goes, especially if it worsens with physical activity, it could be your heart struggling to get enough oxygen. Number 12, frequent nighttime urination. Waking up multiple times a night to urinate isn't just a bladder issue. It could be a sign of heart failure. Many studies indicate that seniors with heart problems often experience nocturia, an urgent need to pee at night. Here's why. When the heart weakens, it struggles to pump blood effectively. This causes fluid to build up in the lower body during the day. But at night, when you lie down, that fluid redistributes, sending excess liquid to the kidneys, forcing you to wake up and pee multiple times. If you're waking up 2, 3, or more times a night, it may be time to check your heart. Number 11, shortness of breath while lying down. If you find yourself propping up extra pillows at night just to breathe comfortably, this could be a warning sign. A groundbreaking 2020 study found that orthopnea, shortness of breath while lying flat, was linked to heart dysfunction in over 60% of cases. Why does this happen? When your heart weakens, fluid backs up into the lungs, making it harder to breathe. This is why some people with heart disease wake up gasping for air or need to sit up just to feel normal. If lying down makes you feel suffocated, restless, or gasping for air, it's time to pay attention to your heart. Number 10, worsening snoring or sleep apnea. Loud, persistent snoring is more than just a nighttime nuisance. It's a sign that your heart is under strain. Sleep apnea causes repeated pauses in breathing, reducing oxygen levels and increasing blood pressure. This puts constant stress on the heart, making it work harder every night. Over time, this can lead to artery damage, high blood pressure, and an increased risk of a heart attack. Many people don't realize that worsening snoring or frequent wake-ups could mean their heart is struggling. Number 9, cold sweats at night. Waking up drenched in sweat without an obvious reason could be an early distress signal from your heart. When the heart struggles to pump efficiently, it triggers the nervous system, causing night sweats. This is not normal sweating from being too warm. It often happens despite feeling cold or clammy. If night sweats are paired with chest discomfort or dizziness, it could mean a heart attack is approaching within weeks. Many people ignore this sign, thinking it's hormonal or stress-related, but it's a red flag that shouldn't be overlooked. Nearly half of all heart attacks happen without noticeable symptoms, especially in seniors with diabetes or high blood pressure. For them, the first symptom of a heart attack is the heart attack itself. That's why relying on symptoms alone is dangerous. We're exploring the warning signs now, but it's still true. Many people feel perfectly fine until the moment they experience excruciating chest pain, or worse, their heart suddenly stops. For this reason, regular checkups, heart scans, and lifestyle choices matter. If you wait for symptoms, it might already be too late. Number 8, swelling in the feet and ankles. Have your shoes suddenly started feeling tighter? Do your ankles look puffier than usual? This isn't just a circulation issue, it could be your heart struggling to pump. A 2023 study confirmed that leg and ankle swelling is one of the most overlooked signs of heart failure in seniors. When the heart weakens, fluid builds up in the extremities, causing swelling, especially in the feet, ankles. If you press a finger into your swollen ankle and the indentation stays for a few seconds, this is called pitting edema, a classic sign of heart dysfunction. Number 7, a persistent cough that won't go away. If you have a lingering cough that's not from a cold or allergies, it could be coming from fluid buildup in the lungs due to heart failure. A 2021 study found that a persistent dry cough, especially one that worsens at night, was an early sign of heart-related lung congestion. In some cases, people may even cough up pink, frothy mucus, which signals severe fluid overload. This is a medical emergency that requires immediate attention. A chronic cough isn't just a lung issue. It could be a silent cry for help from your heart. Number 6, cold, numb, or tingling hands and feet. If your hands or feet always feel cold, tingly, or numb, it might not just be poor circulation. A 2022 study confirmed that reduced blood flow from a weakened heart leads to poor circulation in the extremities, causing coldness, numbness, and even skin discoloration. This happens because the heart struggles to pump oxygen-rich blood to the hands and feet, leaving them feeling cold or even bluish in color. If this happens frequently, even in warm temperatures, your heart may not be pumping efficiently. Number 5, sudden weight gain without explanation. Have you noticed the scale creeping up despite no major diet changes? Gaining a few pounds overnight might not be from food. It could be fluid retention from heart failure. A 2022 study in Mayo Clinic proceedings confirmed that sudden, unexplained weight gain is often one of the first signs of worsening heart function. This happens because a failing heart can cause fluid to accumulate in tissues, leading to rapid bloating, swelling, and weight spikes. If you've gained 5 pounds or more in a short time without a clear reason, your heart may be struggling. Number 4, dizzy spells or lightheadedness. Have you ever stood up too quickly and felt dizzy, or had moments where the room seemed to spin for no reason? While occasional dizziness isn't always serious, frequent lightheadedness can be a warning sign of heart disease. A 2023 study confirmed that seniors with undiagnosed heart conditions were twice as likely to experience sudden dizziness due to inadequate blood flow to the brain. This can happen when the heart fails to pump enough oxygen to maintain proper brain function. If dizziness is becoming frequent, it could mean your heart is on the edge. If your body is sending these signs, don't ignore them. A heart attack could be close. Here's what to do right now. 1. Pay attention, don't ignore it. These are red flags, not minor annoyances. Many people dismiss them until it's too late. 2. Check your blood pressure and heart rate. A sudden increase or an irregular heartbeat can mean your heart is under stress. Monitor your numbers. If they're abnormal or fluctuating, don't wait to see what happens next. 3. Call your doctor immediately. Schedule an appointment and describe your symptoms in detail. 4. If symptoms are severe, call 911. Many people don't realize they're in danger until it's too late. 5. Start heart-healthy changes now. Eat heart-friendly foods like leafy greens, healthy fats, and nuts. Cut back on processed foods, salt, and sugar. Get moving. Even light activity improves circulation. Manage stress. Deep breathing and relaxation help reduce strain. 6. Stay on top of prevention. If you have risk factors like high blood pressure, diabetes, or a family history of heart disease, don't wait for a crisis. Get regular checkups and make changes now before a heart attack happens. Ignoring these signs won't make them go away, but acting fast could save your life. Number 3, unexplained nausea or stomach pain. If you've ever felt nausea, bloating, or upper abdominal pain out of nowhere, your gut might not be the real problem. A 2022 study confirmed that many seniors experiencing heart failure reported frequent stomach issues like nausea, indigestion or discomfort under the ribs, mistaken for acid reflux or a digestive problem. Why does this happen? A struggling heart can cause blood to pool in the digestive organs, leading to unexplained stomach discomfort. If you have these symptoms without a known cause, especially with dizziness, your stomach may not be the problem at all. Number 2, fatigue that feels different. Feeling tired now and then is normal, but if even small tasks leave you exhausted, your heart may be in trouble. A 2022 study confirmed that chronic fatigue was one of the earliest warning signs of heart failure, especially in seniors. Here's why. When your heart weakens, it struggles to deliver enough oxygen to your muscles and brain. That's why climbing stairs, carrying groceries, or even standing for too long can feel like a marathon. And the scariest part? This exhaustion happens long before chest pain ever appears. If you've been blaming age for your constant fatigue, think again. Your heart may be waving a red flag. Number 1, a subtle feeling that something is wrong. Some people describe it as a deep sense of unease. Others say they just don't feel right, even though all their tests come back normal. A breakthrough 2023 study revealed that many seniors who later experienced heart attacks or heart failure reported a vague, hard-to-explain feeling of discomfort in the days or weeks leading up to their event. This isn't just paranoia. Your body is always sending signals, and if something feels off, you need to listen. If you've been feeling off, experiencing strange symptoms that don't add up, trust your instincts. Your body warns you before a heart attack, but only if you know what to look for. The best way to protect yourself is to act now. Waiting too long could be a fatal mistake. Your heart is the only one you've got. Protect it before it's too late.
And there you have it. What are your thoughts? Next, dive into this video for more essential tips to transform your health and help you thrive. You're going to love it. Thanks for watching Healthy End, and we'll see you there.